I am Dr. Brad Makama with Southernmost Foot and Ankle Specialist. Today we're going to talk about heel pain or plantar fasciitis. This is the most common thing that we see in our office. It is not uncommon to see 15 patients per day with this condition. The most common symptoms that you may present with are pain first step in the morning. You may walk painfully for a first few steps, and this will loosen with time and feel better. You may experience this pain later after sitting for any period of time, again, then getting up, experiencing the same pain as you felt in the morning. Pain may also be present toward the end of the day when your feet are tired or being from unsupported, and we will talk about that later as well. This may also have occurred with increased activity, possibly increased activity because you have recently gained weight. Increased pressure from your weight and increased activity put a lot of excess stress on the foot, and we will also talk about that. This is the anatomy of the foot. The region that you're having heel pain is here at the attachment of the plantar fascia to the heel bone or the calcaneus. The main reason for this pain is a lack of flexibility in the plantar fascia, accompanied by micro tearing here at the attachment to the heel bone. This happens due to excess pressure downward from increased weight, or a combination of increased weight, increased activity, and a foot that pronates or rolls in, or the arch collapses, or dropping down of the arch, putting strain on the fascia, causing pain and inflammation here due to lack of flexibility. As you get older, this fascia does not stretch as it once did, and then will tear, partially tear, instead of stretching. This will cause a spur to develop due to chronic pulling in this direction of the fascia, and a spur may develop in this area. We will examine your x-ray for this momentarily. Spurs may also develop in the back of the heel here due to a tight Achilles tendon, which also adds to the entire process of inflammation. On the x-ray, we will also examine the arch for a decrease in the arch height, which may be due to a falling arch or excessive pronation, and we will address that in a moment. This is the bottom of the foot. You can see the heel bone here. This is demonstrating that the plantar fascia is a broad band encompassing the entire base of the heel, extending all the way through across the foot and inserting somewhere behind the toes here. So when we talk of tearing or partial tearing, we're talking small injuries of a very broad structure. Also, when we speak of stretching, we're not talking of stretching one thin strand, but a large band of fibrous tissue. This is an x-ray of the foot. We'll be looking at your foot momentarily. The areas we're going to focus on are back at the area of the heel, looking at the spur in the bottom and the back, also in the area of the arch. When we look at the top of the arch, we would expect the arch to be up in this area. As you can see with this foot, the arch is collapsing or dropping down here due to excessive pronation. This is adding to the pressure on the plantar fascia at the bottom. This is a spur on the bottom of the heel, and this is due to chronic pulling of the plantar fascia. This spur is all excess bone not normally present. On the back of the heel, a similar spur can develop, and again, this bone is not normally present, but develops in response to constant pulling from a tight Achilles tendon. We will evaluate your foot for these processes in a moment. This is a diagnostic sonogram. On your next visit, we may use this machine to look at the thickness of the plantar fascia. This is similar to what is used for an unborn baby. It looks at the tissues inside, and we can get an estimation of how thick or inflamed the plantar fascia is. We're going to examine your foot for the flexibility of the plantar fascia through here Examine the area here for pain. Examine the heel bone itself for any other abnormalities or pain that might be present. The Achilles tendon and its insertion for any type of pain. The amount of flexibility at the Achilles tendon here, and look for any limitations present in this area. We will also examine your foot for pronation, or the rolling inward of the foot, demonstrated as the collapsing of this side or the inner side of your foot rolling inward. We will be reviewing stretching exercises with a handout exactly like this, with self-explanatory pictures, as you can see here, stretching the Achilles tendon and plantar fascia. You will note the last exercise is a can rolling exercise in which a rolling pin or PVC pipe is rolled under the foot to massage and stretch the plantar fascia. In addition to the stretching exercises, an important device to remove the morning pain is a plantar fascia night splint. This splint holds the foot at 90 degrees. This is worn while you're sleeping. This can also be worn while watching TV or reading or relaxing. What it does is prevents the foot from being in this plantar flexed position. When you're sleeping, the foot is relaxed, the fascia is relaxed, the Achilles tendon is relaxed, all allowing these structures to tighten. Your first step in the morning stretches it to its maximum level. With the night splint, we keep it at 90 degrees and prevent that severe morning abrupt step and preventing the morning pain. As you get older, the fat pad in the bottom of your heel becomes weak. In some cases, you may need additional padding on the bottom of your heel. A silicone heel cup may be used to cushion the heel if that is the case for you. Additional devices such as this Achilles Air heel has an air pocket in the bottom, also at the Achilles tendon. This may be something that you will need as well. We will evaluate each product for your specific needs. The best and most common device needed to treat plantar fasciitis is an orthotic. This is the device that will fit into your shoe. It is a semi-flexible material that allows for some flexibility but maintains the arch support and prevents pronation. If you look down here, you can see that I have a reasonably normal arch prior to stepping down. When I step down, the foot collapses and rolls in or pronates. When my foot pronates, if you look at my knee, you can see the knee rolls inward as the foot pronates. This rolling inward of the knee causes strain on the knee, the hip, and the lower back. When stepping down into the orthotic, you can notice that the knee does not have that inward rotation. Thereby, the orthotic stabilizes the foot, reduces the pressure on the plantar fascia, and allows the knee to function in the correct plane. This is my own orthotic. This exact orthotic I have had and used for the past 6 years. They last for quite some time. This orthotic slides right into an athletic shoe. When looking at an athletic shoe, you want to have support and may even see additional modifications here to prevent the shoe from collapsing or rolling inward. A cross trainer or basketball shoe may be the shoe for you, as it may have more support than a running shoe would. We will also focus on physical therapy. This is ultrasound therapy in which sound waves are massaged into the foot, causing a deep tissue massage. This will break up scar tissue and help mobilize tissue to promote flexibility and promote healing. This is an interferential therapy in which electrical nerve and muscle stimulation is done to reduce pain and inflammation. Those therapies are available here in the office, as well as taping of the foot to support the arch. Commonly, we will continue to tape the foot to support the arch and relieve the pressure on the plantar fascia until your custom orthotics arrive. The custom orthotic is made by taking a plaster cast of your foot held in a neutral position. This captures the exact arch that you have. This is sent to the lab, scanned with a laser, and the exact arch is built for your orthotic. We are working on new technology that we can scan directly here in the office, and hopefully that's available by the time you're watching this video. Additional treatment is needed for anti-inflammation. Your best treatment for anti-inflammation is ice. Several times a day, applying ice to the heel is necessary, especially after you've been on your feet for a long period of time or after any activity. And of course, we recommend limited activity. Next, for anti-inflammation would be medications such as ibuprofen or any of the other prescription anti-inflammatory medications. We will discuss what's appropriate for you. If the inflammation is severe or a bursitis is present at the insertion of the fascia, you may need an injection. A Depomedrol or similar corticosteroid injection will be explained as far as if you need it or when you may need this. On your subsequent visits, we will evaluate how flexible that you've become from doing the stretching exercises, evaluating the Achilles tendon flexibility as well as the fascia flexibility. We'll see how much pain you still have in this area. We'll see if there is a focal bursitis and an injection may be needed. Hopefully not. We will also examine to see how the night splint and orthotics are functioning and working for you. The simple rule to evaluate where your pain is and what your treatments are first step in the morning pain needs more stretching. Pain may also be relieved with the night splint as a very important factor to relieve the morning pain. Pain all through the day or a constant pain in this area will need an injection. Pain at the end of the day or sore feet will need additional arch support as an orthotic as well as proper supportive shoe gear. I hope your feet feel better soon.